Hi, welcome everybody. Apologies for the technical hitches. Facebook wants to just keep me on my toes. So thank you for jumping in and joining us on a Facebook Live in the afternoon. Just a bit of a change for the evening folks. We have been joined today from a wonderful team who are working on a study called the RESTED study, and I'm going to introduce them in a second. But to start off, my name is Dr. Liz Corcoran. I'm the chair of the Down Syndrome Research Foundation, and we are the UK's charity focused on medical research to improve the lives of people with Down syndrome. So obviously, we're very passionate about research, but in particular, we have got a real focus this month on sleep research because we have launched our Down syndrome and sleep research network. And that's a special organization, campaign, grouping of researchers and health professionals who have a similar interest and passion about a particular topic. For a long time now, we have felt that sleep is under-researched and incredibly important part of the puzzle to understand the difficulties that our loved ones with Down syndrome face, not only in their younger years, but as they grow older. So we're incredibly excited to be able to launch the Sleep Research Network, to bring researchers like these ones we're meeting today together so that they can think about what does the future of research in sleep and Down syndrome need to look like, and how can they support clinicians that work now with adults and children around sleep who have Down syndrome. So look out for announcements, tell your local sleep researchers about this new initiative. And wherever you can, whenever you can, share research studies like what we're going to talk about today so that others can get involved and support research. So I've done my little spiel, guys. I'm going to go across and introduce the team who have agreed to join us today to talk about the RESTED sleep study. Hello, everybody. How are you doing up there in Scotland?
Hello.
Hello.
You're well.
Good. And so today we have, first of all, I'm going to introduce Dr. Florian. Dr. Florian, tell us a little bit about where you're based and what's your background.
So I'm a consultant respiratory pediatrician at the Royal Hospital for Children and Young People in Edinburgh. And I am the chief investigator of the RESTED study. And you will hear more about it over the coming few minutes.
Lovely. And you also have with you Emma Carruthers. Hi, Emma.
Hi.
Tell us what's your background and how are you involved?
So I work here at the Children's Hospital and I'm the lead sleep physiologist in the department, which basically run the diagnostic service for sleep studies for children up to 16 years of age across the Lothian region. So.
Wonderful. And we also have Dr.
If I may chip in,
oh.
Emma is also the person that you will be interacting with if you join the study from the very start, and we'll have very much interaction with Emma throughout it. So
Emma, you're at the front door. Wonderful.
Yeah, I'm at the end of the phone.
Lovely. We're going to hear more about what does that entail. And also we have Dr. Jessica Street. Welcome, Jessica.
Thank you. So I am also working here at the Royal Hospital for Children and Young People in Edinburgh, and I'm a consultant community paediatrician. So I work directly with children and family who are affected by developmental difficulties. So I've also got an interest in sleep and was part of the study right from the beginning when it was first designed. So I'm really excited that we're here today.
Yes, so am I. I'm so pleased always when I hear about researchers that are passionate about this. So yeah, let's just kick off and just help us understand, first of all, what is the RESTED sleep study and how was it born? How did it come about?
So if I may make a start here, so I think it's really important to understand that we are researchers, but we are also, as Jessica already alluded to, we are clinicians at the front, and we have daily interactions with our patients. That includes children from birth till 16 years, and also obviously children with Down syndrome and their families. On the other hand, we have got other roles as well, as two of our team are lecturers for Sleep Action, which is the former Sleep Scotland, a charity that's passionate about sort of improving sleep in children. And one of our team members is also an active member of Down Syndrome Medical Interest Group, but also was a former chair of the Down Syndrome Medical Interest Group. So what combines us in a way is a passion about sleep, improving sleep in children, and especially obviously in children with Down syndrome, because children with Down syndrome, as many will know, have a higher incidence of sleep problems generally than their typically developing peers. And the problem with untreated sleep problems in children is that it can lead to obviously sleepiness during the day, behavioral and emotional difficulties, to cognitive impairment, to reduced quality of life, and also to reduced academic attainment. And given that intellectual disability is obviously related to children with Down syndrome, to their condition, it may result in a sort of a reduced cognitive reserve, and therefore they might be impacted more by sleep difficulties. And children's sleep problems can also have a detrimental effect on their parental well-being. And I think that's really important. So the impact on carers who might be sleep deprived for other reasons already anyway, but this can additionally affect them. And these bits is what we are looking at and trying to study and improve. And there was a previous study many years ago by a research team from Portsmouth that demonstrated that parental group education can improve the sleep in children and behavioral sleep problems in children with Down syndrome. But this was never made widely available, and it sort of dates back quite some time, so it needed updating. So the aim really that we have with our study is to show that a fairly brief but targeted intervention, including a video and a booklet on sleep, will help to improve sleep and behavioral sleep issues in children with Down syndrome.
Wow. Okay. So you guys are looking at a lot. There's a lot of information. So if we go back to what you were talking about at the beginning, is that what you've seen and noticed as clinicians and those that have gone before you, is that the sleep issues that you see in children with Down syndrome, they have a sort of exaggerated effect on how they function during the day, compared to a child who doesn't have Down syndrome, that you notice that it has a big effect on how they learn and the way their brain's functioning. And I think it's really important that impact on the family network as well. The kind of things that people talk to me about, I'm sure they say to you, that how it affects the functioning of the whole family unit the next day when you don't get sleep. It's really rough. I'm sure these stories are familiar to you. You're nodding away, Jessica. I'm sure you've heard lots of that stuff. Yeah. So if we think about why is it so important then to gather this information? What's the kind of importance of knowing if this kind of thing works?
So certainly our aim would be the hope will be that this intervention does prove useful, and that we can document both with objective measures, and you will hear a bit about what is involved in the study, but also with questionnaire that actually parents and caregivers of children with Down syndrome do find this as useful tools to use with their children and improve their sleep. And that we can document as well that the parental well-being is improved. That again, this is mainly by feedback via questionnaires. One thing that I want to maybe also emphasize is that part of the study involves, and Emma will talk about that probably in a while, what is involved is actually a sleep study at the very start of it, because while the focus of our study is on sort of improving behavioral sleep issues, we want to screen for obstructive sleep apnea. So the moment where children basically obstruct their airways during sleep and have problems and arousals during the night, which in itself can impair sleep. And we know as well that this is more common in children with Down syndrome as well. So the start of our study is actually to do a sleep study and to find out whether there are children that have got significant obstructive sleep apnea. Now, it's important to know that those children that are shown to have significant obstructive sleep apnea won't proceed with the further study aspects of our study, because we assume that the most important aspect of this disturbed sleep will be the obstructive sleep apnea. But that doesn't mean that from the start, even if you have concern that your child might have obstructive sleep apnea, as long as they haven't had a sleep study that confirmed that in the past, they're still eligible to take part in the study, and we will feed back about the results, obviously.
Okay. So Emma, then if someone comes, they're interested in being involved, the first step would be to chat to yourself. Is that right?
Yes, so the first step would be that they would, well, initially make contact with our coordinator, Taylor, and she would run through some basic screening questions just to make sure they're eligible. And then at that point, and they will be given basic information around the study, the patient information leaflet. And then from there, if people are happy to proceed, at that point, they then get contact from me. I will do the official consent and we'll go through all the inclusion, exclusion criteria again, just to double check they're okay to proceed. And then
sorry, that's the things that mean that someone can't be involved. Is that what
yeah, so we have specific we're trying to be as inclusive as we can be. So the basic criteria is that the child at the point of the baseline visit needs to be 6 months to 5 years old.
Okay.
And we now recruit in UK wide. So up until this point, it was Scotland only, but we've now got approval to go UK wide, and hence all the advertisement that's going out there. We've got logistics in place so the study can be run remotely. It doesn't involve coming into the hospital and collecting equipment and things. All that will be sorted out, couriered out, posted out.
As much as we would love a trip to Scotland.
I know, there's a nice mini break to Edinburgh. It's not.
I know. Yes, that is wonderful. And we were so happy when we heard you guys had got approval to run this for people in England as well. So this is great news. Okay, so they get contact with Taylor and they go through their child's story, and they look for whether they can come and whether they can take part. Okay.
Yes, yeah. And if there's any specific medical questions and things at that point, they can ask, and that can either be directed to myself or Florian or Jessica, depending what the question is. So we definitely are checking everyone's eligible and things right from the start, so people can be clear about what's involved, etc. Yeah. So, and then from there, the process starts as such, the official process. Yeah.
Okay. And Florian just touched on it there as well, that there is involved a sleep study, but for those who don't know, that they're not something that we have to necessarily come to clinics for anymore. So this is all done via things posted to you in your home. Yeah, is that right?
That's right. So COVID definitely pushed services, clinical services, into looking into these options. And, you know, from a sleep service point of view, we do this routinely in our clinical practice every day, but as well as that, we can now do the study. So that involves me, we call it a cardio-respiratory sleep study, which is quite a mouthful, I understand, but basically what we're looking at is to look at the breathing pattern of the child overnight and the oxygen levels, and we're screening for sleep disordered breathing. So it entails putting some non-invasive sensors on, so some stretchy belts around the tummy and the abdomen, a little sensor at the nose to look at the airflow, and then a probe that looks at the oxygen level. So the kit is designed for home use. It's very small. We can literally post it out. There'll be an instruction leaflet. Hopefully there will be a video. If not, there'll be a telephone call from me talking people through the setup as well. But so it is quite straightforward, and that will all be done, posted back to me, and then at that point the study will be analysed. We'll look to see if there's sleep disordered breathing on the study. If the study is normal or in the mild category, the family will be contacted to say they can proceed in the study if they're happy to. If we do pick up moderate to severe sleep disorder breathing, again, the family will be notified of that and advised that if we have permission to contact their GP, and then they'll feed into their local clinical network. So,
okay. So the results of that study isn't secret. You guys, of course, but
Yeah.
maybe don't realize, you guys, of course, if you find something that's important and needs action, with their permission, you let the GP know. So that's really important that people understand that studies like this, realize that there's information that sometimes needs to be acted on. You mentioned the word probe, and I think sometimes we worry probe is not an internal thing that has, it's something that the little one would wear on their finger or their toe, and you would
It's like a little sticky plaster, yeah. So.
Yeah. And there's lots of pictures out there, and I'm sure you guys have, photographs of what it all looks like. But most children find it tolerable. And the great thing about these studies is that the child's sleeping in their own bed, which, is far and away much more likely to have a successful sleep study than it is when you're in a strange, different environment with lots of beeps and things. So that's really good to know. Okay. So then some of the children will then at that point step off the study if they have mild to moderate breathing issues.
Moderate to severe. So if they're moderate to severe, they can't continue with the study. If they're mild or have no sleep disorder breathing, they can continue with our study.
Yeah, okay. And then the next bit is where you look at behavioral interventions, where you teach the parents, the carers around sleep behaviors and different interactions that families can have during that evening time. So does anyone want to talk about what that might look like? What will the parents kind of expect? How much time would they need to devote to doing your program?
Do you want to speak to that, Emma, or shall I?
So the educational program involves a group education session, which I think lasts about half an hour. And then there's obviously opportunity for questions at that point. And then as well as that, they sent the link to the education booklet as well. So they always have access to that.
Okay.
So yes, it's kind of a one-stop shop as such. On the night, they'll get the education session, the opportunity for questions, and they'll have at that point access to the booklet and throughout the study. Obviously, the study is divided into two limbs. So one group will have the education session, and then the other group will have a parallel education session, but not involving the interventions. But at the end of the study, everyone gets access to all the educational materials. So nobody misses out on the...
So maybe just to clarify that as well. So the education that the parallel or control group gets is still very relevant to Down syndrome. So it's useful information, but it will not center around sleep. So, and that is just to make sure that actually the intervention that we do can be compared and that we can document the difference between two groups and make sure that our intervention is actually successful. But as Emma said, I think the most important thing is that at the end, the intervention will be available even to the control group as well.
Yeah, I think that's a really wonderful thing, that if anyone has any sort of worries that they will not be in the group that gets the intervention the first time round, they won't be missing out because everyone will receive the materials at the end. That's really helpful. Thank you for talking us through that journey. And then at the end, how do things finish off in terms of how do you check if the intervention helped or not?
Okay, so at various time points, prior to the intervention, we do a baseline, what we call an actigraphy study, which is a small watch-like device that the child needs to wear for 2 weeks and completes a diary. And this device looks for movement, and then we can use that as a proxy for sleep-wake patterns. So we can get an estimate of what their baseline sleep-wake patterns like along with the diary. And at that point, the series of questionnaires are sent out. And then the same thing happens at 1 month after the education session, 6 months and a year. Obviously, at any point, if anyone, family circumstances change, it gets too much, people can pull out, that's fine. But it's the same the same, particularly if they study the same questionnaire. So once you've done it once, people tend to get into a bit of a rhythm with it and they're quite comfortable with it. And again, that's something I will liaise with the families, send out, all the links are sent out via email and back again. So yes, it's all can be done remotely as well.
Okay, great. And you mentioned an important point that is always true of research is that you can always change your mind at any point. No one's forced once you begin a study to complete it. So we just would hope that you want to complete it, but
absolutely. And I think it's really important that also to emphasize, and that will be clarified at the beginning as well, you don't need to give a reason. So if you can say, we would obviously want to know if there was a specific reason, something that you didn't enjoy about the study prompted you to pull out, but you can just say, that's it, that's finished for me, thank you very much. So
absolutely. Yeah. Okay, that's really helpful. And is there anything that people need to know about how to get involved? What's the most quickest way to let you know if you want to sign up and be involved with the study?
So we're sharing our email address and our telephone number, which I'm hoping you're putting in the chat for us, Liz. Brilliant. So the quickest way is just to get in contact either by email or by phone. We would then send information out to you, and then as part of that process we would then need back from you to say that you want to take part. And at that point, so it's either a reply slip or we would just an email back, and at that point we'll then set up an online first appointment to go through what the study involves and get your permission to take part.
Right. And from the beginning to the end, about how long do you think someone would expect the whole kind of process of being in the RESTED study would take?
I think from the initial screening study, so sort of from the initial point of contact and saying you're happy to proceed and they're eligible to proceed, I would roughly say 18 months, because we have to in part collect a group of people to then put through the education session. So we have to get a group of people through the screening study. Once we've got that group collected up, then we start the process of the education and the questionnaires and things, which takes 12 months, but probably from the initial point of contact. So families that are initially contacting me now, I'm kind of saying we'll probably be doing the intervention around March time. So it's just logistics really of equipment and things that.
Yes, and I personally, I think it's wonderful that you're running it like as a group intervention. I think that there's great power in that. I think for delivering healthcare interventions, people being together with their peers, I think is probably the way we're going to educate people in the future around healthcare intervention. So it's wonderful you're testing that in our community as well. People often are wondering, will this affect, their healthcare in the NHS? Will what doing the study affect it? Do you want to take that one, Jessica? Is like, in terms of...
So no, it won't affect your healthcare at all. I think, as we've already touched on, if we pick up that there's a problem with sleep disordered breathing, or if we do have sort of concerns that are raised while progressing through the study, of course we're going to make sure that you get the right treatment and help for that, and it would involve contacting your GP. But actually we will obviously also need to know about any sort of significant events that happen during the study, because we have to document them and report on them as you would do for any research study. But no, it will not affect your NHS care at all.
Wonderful. And at the end, we always love to hear about what you guys found out. And so what would be your plan for coming and telling the community about what you've discovered when you're finished?
Well, once we reach the end of the study, and I think it's probably really important to sort of point out that when we're analysing, we won't know which group the children are part of, to make it a truly sort of blinded study, so that therefore it makes the results valid. But we would be looking to publish the outcome of our study to the community. We'd also be looking to make the education package widely available to children with Down syndrome if it's shown to be helpful.
Wonderful. And we would love to invite you guys back if you want to come and tell us what you've learned. And maybe, if it's often leads to another study, we want to do what we can to support you guys in that. Thank you so much for being here today. Any final closing thoughts from any of you guys?
No, thank you very much for the time we had with you today. And I think it would be great if whoever is watching us live and anyone who is using the video at a later stage, that you contact us if you're interested. Don't hold back and worry that your child might not be eligible. We are very willing to discuss this, but the information leaflet we will send out contains some further information that you can read beforehand. But if in doubt, please just speak to us. As you can see, we are very approachable. We are clinicians and people who work with patients on a daily basis. So please feel free to make contact with us.
And I can absolutely confirm that you guys are very nice and kind off camera and on camera. So thank you so much for being with us this afternoon and telling everyone about the RESTED study. We wish you the best of luck for filling up all your recruitment slots, and we can't wait to hear what you learn.
Thank you very much.
Thank you.
Thank you.